So would you be surprised to hear that 1/3 of all cosmetic procedures are performed on men, and that number continues to grow? Did you know that stem cell therapy is becoming mainstream? It's now being used in cosmetic surgery procedures. Were you aware that there's now a permanent hair solution for thinning eyebrows and thinning hair for women? Leslie, thank you for that generous introduction. So I'm really excited to be here because many of you know that this is all in my wheelhouse. I've been working on skin health as it relates to really the gut, fixing our gut and working through diet and lifestyle changes. But today we're going to add to our anti-aging arsenal with this incredible panel of experts. We're going to be learning about the latest in regenerative medicine and beauty care. So I'd like to start off with our curator of the event. She has brought us these two illustrious panelists. Lynda Barens. She is considered to be the plastic surgeon whisperer. She is a beauty concierge, a curator of the best. She will single-handedly put together your entire medical protocol, including sourcing doctors, identifying appointments, scheduling, arranging for your travel, food, even nutrition. Hopefully you'll talk to me about that. And she also specializes in doing makeovers as well. And then we have Dr. Ghaly Perrault. Dr. Perrault is a board-certified physician and surgeon with 20 years of experience in treating various hair loss-related problems in men, women, and children. I didn't know that. He specializes in restoration of the scalp and facial hair, including sideburns and eyebrows. A large part of Dr. Perrault's practice involves the treatment of patients with prior unsatisfactory hair restoration therapy and the repair of hair loss following cosmetic surgery procedures, which I'd like to hear more about. And then we have Dr. Fouad I, who's a world-renowned specialist in regenerative medicine therapies, including platelet-rich plasma therapy, hormone replacement therapy, and specific stem cell research and application. At his Ghaly Center for Regenerative Medicine, Dr. Ghaly incorporates innovative scientific research, alternative therapies, state-of-the-art technology, and conventional medicine to create a customized treatment plan for his patients. So I'm going to start with Lynda, our beauty curator. So what prepared you to do this job as the plastic surgeon whisperer, and what does that mean?
Well, I started working for a very renowned plastic surgeon for 10 years. When I left his practice, I worked for an ocular plastic surgeon at UCLA. I left there because I got a phone call from a world-renowned plastic surgeon that was looking for a consultant. I went to work for him for 15 years. There isn't anything I didn't learn from him. I am one of the most curious people in the world. I am always taking notes. I watch everything. When he was doing new techniques, I wanted to see them, be it a new filler, a new laser, anything like that, a new suture, whatever it was. I just felt that I needed to know so that I could explain to the client. I get very close to the patients because it's something that they need. They need the nurturing, they need the understanding, and that's how I started.
So what I found really interesting when talking to you is that doctors and patients allow you into the surgical room and you actually watch these procedures being performed. I find that to be fascinating. Is that a common practice, or is that something that only someone with your expertise is allowed to do?
Only someone with my expertise. You have to have the patient's permission to be able to do this. So when I'm actually meeting with a new doctor, that is one of the protocols that I have. I will follow a patient from their pre-op visit to observing the surgery. I will watch the patient after the surgery, a day after, 10 days after, a month later, 6 months later, a year later. I'm constantly doing things like that.
Okay, so all of us in YPO, WPO, we always have our hands on the latest, the greatest, the best doctors. We have friends who do things. So why am I going to come and spend money on your services? Why am I just going to go ask my friends, saying, well, who's doing this for you? Who's doing that for you? Tell me all your secrets.
You know what, Lauren? Everybody does that. They're listening to hair people, makeup people, their friends are looking at work, but nobody has the 25 years of experience that I have. And I'm very particular on which doctors I represent and work with. I vet them like nobody. And I know their ins and outs. I know the good, I know the bad, and that's what I share with my
Who's the bad?
clients.
Who's the good?
Wouldn't you like to know?
We want the dish, right?
Let's reapply it first.
Okay, so how do you curate your list? I mean, I'm just kind of new to this whole world of plastic surgery because I try to work on everything through diet and holistic health changes.
Well, as I say, I'm a very, very curious person. So surprisingly, the people that give me the most knowledge are registered nurses that care for their patients, along with other doctors. I'm always asking them, you went to a conference, what did you think of that talk? Talk to me about who you think your wife would go to have her nose done, et cetera, things like that. I also have a tremendous resource with celebrity makeup artists and celebrity hair people, because they're the ones that are covering up all the botched jobs.
Right.
So we have a wonderful camaraderie, and we share information back and forth so that I can build and curate the list that I have that, as I say, I'm very particular about.
So speaking of botched jobs, so I don't know about you ladies, but I've seen, in fact, starting with my own mother, a really bad facelift where she actually lost most of her hairline. So can I ask you, Dr. Perrault, about what can be done following a surgical procedure that, you're losing, can graft hair onto those areas in the temple, like the hairline. I've seen a lot of this happen, and I don't know if that's just an old procedure or if that's a common result.
Can you hear me?
No.
Do I think I'll pull this a little bit closer. Here. I wouldn't call it common, but it's something that we see routinely. And it happens with greater frequency with people who are more aggressive and less experienced and less, I think, talented. It happens less frequently with the people who are at the very top of their game, the cream of the cream. But it can happen with any surgeon. You can have the very best guy in town will have some, less than optimal outcome, and they may lose his hair in the temporal areas here, especially in women or men who've done multiple procedures. If they've done one facelift, the risk is way less than if they've done two, or especially 3. Once they get to repeat procedures, then these things are much
Isn't
more
there a
common.
point where one facelift too many? 1, 2, 3?
Yeah, especially
You're
with
saying
Most of
sideburn
my
area.
friends are on their second.
On their second facelift. I found that to be shocking. Most people on their second facelift.
But especially in the sideburn area, because they're pulling this mid-face area back and back, and eventually the sideburn that used to be here is now back there. And so we do repair that, and it can be fixed in the vast majority of people, and it just requires 1 or 2 surgical procedures to transfer hair from the more what we call the safe donor area, where the hair is very healthy and strong, and artistically relocate that so that it duplicates the once existing hairline that's been pulled back, or the temporal area or the sideburn area.
Are you using all human hair? Do you ever use synthetic hair for this procedure?
The use of synthetic hair was done, decades ago, and actually is outlawed in the U.S. to surgically implant synthetic hair. It's done in other countries still, but because when you place a foreign object into the skin and the end of it is protruding outward, that bacteria migrate uniformly 100% into those areas, and so they become infected and have to be constantly replaced and treated with steroids to quell the inflammation. It's sort of a messy undertaking after they've been in there for a year or so, and I wouldn't recommend it.
So what I found was very interesting was the eyebrow replacement. I have a lot of clients in my practice with Hashimoto's, and with any thyroid disease, you tend to lose the outer third of your eyebrow. It happened to me. So what can be done with that? I see a lot of people doing the tattooing, but you're doing actual hair restoration to that area. Can you explain that process?
Well, what
please?
we're doing is taking follicles from usually this area around the back and the sides of the head where the hair is very stable and healthy and strong. And then we in our practice, we match the caliber and the color and the texture. And then we implant that, and it's done with using a very special sort of proprietary technique the way we do it, that the follicle is introduced at the same angle and direction that the eyebrow would be. Now, eyebrows are challenging because the hair exits at almost a flat angle, so it's very tangential. It's not like a scalp hair coming out at 45 degrees, it's almost flat. And so we originally developed this technology for using with pediatric patients, but it's worked out great with adults because it allows us to get very flat. So when we place the graft, the hair is coming out almost flat to the skin. And that's the hard part, because you'll see eyebrow replacement, and frequently it's just sticks straight on like a porcupine.
I've seen that.
Which is
Have you
more
seen that? I've never
acceptable
seen it.
with a big guy, but not acceptable with a delicate feature.
So what about hair transplanting for women? So a lot of women are getting hair extensions. You know, as we age, some of us lose our hair either after babies, premenopause, postmenopause. Are you treating that population of women as well?
Yes.
Or are there more health and serious
Well, with
conditions that
women,
you're
it's a little
addressing?
different than men. Most men, it's sort of a garden variety male pattern baldness that you see. With women, it's a more complex situation because frequently women don't bald, they thin. And it's still a conundrum, you know, as to the cause. And if you read, the more you read in the literature, especially recent literature,
What is the cause?
no one really knows.
No.
I mean, Dr. Olson wrote a book years ago, and everybody assumed that it was androgen sensitivity. We all jumped on that train, and the more we really they research and look at different things, the less we feel we understand it. We know it's probably genetic. We know it's probably androgen related, but no one really understands fully. But we do treat it surgically in appropriate patients, but there are a lot of other underlying exacerbating causes that we frequently see in women. The most common thing I'm seeing lately is protein deficiency because of the veganism and vegetarianism, followed by probably
Any vegans in the room?
yeah, iron deficiency and thyroid deficiency.
Yes, because I see the iron deficiency,
Yeah.
protein deficiency, B12 deficiency
Yeah.
in my practice.
And I always tell patients, if you're not watching these other things, if you're a vegan and you're not fastidious about eating protein,
Absolutely.
then no matter what we do with your hair, it's going to just continue to deteriorate. You
So
have
true.
to do the other things with it.
So Dr. Ghaly, so what can we do? I know you're a specialist in hormone replacement therapy. Hormone replacement therapy has gotten a bad rap because people don't understand about the difference between synthetics versus bioidenticals. Can some of this hormone therapy be used to treat some of these common problems that we women are facing, whether it be thinning hair, whether it be low sex drive, whether it be any kinds of, even like with your platelet-rich plasma therapy, to regenerate the skin? So we don't have to turn to Lynda and go, Lynda, please set up a doctor appointment. We need to get under that knife ASAP.
The interesting enough is that thyroid is an important hormone in our body, and it is actually a primary gland, not a secondary gland in the endocrine system. So thyroid will affect each one of us, all the cells in our body, whether it's the liver, the skin, the hair, the brain, has receptors, even ovaries have thyroid receptors, and lack of which have detrimental effect. One of them is hair loss, brittlity of the skin, of the hair, so you find the hair standing on end, like on somebody, or you touch the skin and you know that they actually have a rough skin, and because of that, it is low thyroid. It's just a given.
That's so
You know,
interesting.
I say
Well, a
that.
rough skin could be indicative of having a thyroid disorder.
Very
That's
true.
very interesting.
Yeah, very true. So the hair on a woman's head is the crown of her head. For a man, if he loses his head of hair,
Or his head.
he is sexy.
It's not a testosterone, right?
And interesting enough, it's inborn in us that he has more testosterone than others. but it's imprinted in your brain subconsciously. You don't know it, but in fact, it's kind of part of our living. So when a lot, like Ghaly, he shaved his hair and all that sort of thing. So anyway, the hair loss in women, for example, part of it is mitigated due to hormonal issues. One of them is androgen. Like some women start to produce more DHT, dihydrotestosterone, than others, because maybe they have
Can we see that through a blood test, Dr. Ghaly?
polycystic ovaries.
But would we be able to see that in a blood test?
Oh, yes.
We see
yes,
the
yes.
DHT levels?
Yes, absolutely.
And can you tell, doctor, like when you touch someone, do you?
I
is
touch my patient. I said, "May I touch your hand?"
Yeah,
or
you
touch
did
your
that to
We'll
me.
cradle mine off, go ahead and touch our
And
hands.
immediately can diagnose you that you are low thyroid. Low thyroid will actually, one of the most, you probably agree with me, is that hair loss in women is due to stress as well. So stress plays a major role in the hair loss. So hair loss is, of course, is demoralizing and debilitating. And if we regain the hair through hair restoration, actually it gives you a good sense of who you are. And when you look at yourself in the mirror, you're pleased with yourself. So that has a positive effect on your psyche, and it makes you feel good about yourself. Just feeling good about yourself has a cascade of hormonal changes in the body in such a way that everything becomes, working in symphony or in orchestrated harmony. You know what I'm saying?
So are you saying that you can mitigate some of this hair loss, hormonal hair loss, genetic hair loss, as a result of alopecia or DHT, by using bioidentical hormone replacement, or is this
It's a
sometimes the answer?
combination. You can never say you only have a hammer to hit a nail. It's nothing like that.
Mhm.
It's
Right.
it's a combination of factors.
Mhm.
So, but in the final results, a lot of women need hair transplant or restoration of hair, either surgically or otherwise. So there are a lot of, it's multifactorial really, rather than, but hormones play a major role in hair loss or hair gain. Let's put it this way.
Excellent. And Dr. Perrault, how much is hair restoration for a woman? I guess it depends how many, and what is that procedure? I mean, how are you going to get, someone has long hair, where do you find the hair to?
You mean economically speaking?
Economically speaking?
Well, it can range, anywhere from, depending if you're doing something minor, from probably, it's not going to be, depending who you go to.
How about you?
Probably.
You go to the best of best.
Well, our basic overhead is close to $10,000, so even if we're doing something very minor and we're trying to work with someone, it's going to be at least that, and it can go up upwards of $30,000 pretty easily too.
Okay, so if we're doing that for 30, Lynda, and how much is the facelift?
It depends on the
Depends
doctor.
who you go to.
Absolutely.
What is the range?
It can be anywhere from $9,000, doctors that are doing 2 or 3 facelifts a day, which are not people that are in my wheelhouse, but $50,000, $80,000. I know doctors are charging $150,000. Depends on the amount of time, the talent, the creativity of the doctor, and the doctor that is doing the most natural work. So, and you don't want to make a mistake. So.
Right. But with your practice and your service, we're not just talking about facial plastics. A large majority of your clientele come to you for actual medical purposes, whether it be breast reconstruction after mastectomy. Can you talk about that a little bit?
Absolutely.
And how you help the patient through that process?
We needed 3. No, it's fine. I'm sorry, what was the question?
I wanted to know about the non-cosmetic clientele that comes to see you, and what are they coming for, and how do you assist them through the process? I would think that I would absolutely, God forbid any of us have to go through that, but going through breast cancer, I've had many friends who've gone and had reconstruction reconstructive surgery more than once, had botched jobs, drainage issues. So, I mean, I see coming to someone like you, you'd be able to kind of hold.
Lauren,
together.
that's what I do. I mean, I really do. I only work with the best. So when people come, and I would say half my clientele come to me with bad work, and they're very upset because they've spent X amount of dollars on having this procedure done. And what I do for them is find the best doctor for them. I'm there to hold their hand, to nurture them through a mastectomy especially, which is very daunting for a person. I have patients that come in that have one breast smaller than the other. Someone had a nose job and it's still bulbous. So I have to find the right doctor for them. And it's very gratifying. When it's all said and done, the first thing they say is, Lynda, why didn't I know you before? Because this wouldn't have happened, believe me.
Absolutely. Dr. Ghaly, I have a question regarding the safety of bioidentical hormones when you have the BRCA gene.
That I can't.
Does everybody know about the BRCA gene?
That, yes, yeah, which is the predisposition for breast cancer. This I can't really address that completely because the information is not in yet. Let me tell you about the bioidentical hormone first. Basically, the reason why we develop to become mature, like we are, we need hormones. So hormones has a major play on moving us from childhood into adolescence, from adolescence to, the pre-sexual era of our life, and then become aware of sexuality, and then later on our reproductive years of life. Unfortunately, but this is how we are created on this earth, or we are on this earth, is that we travel a journey which is the reproductive years of life, beyond which we have already fulfilled our job. From that point on, we start to degenerate. As you have a child, for example, he's regenerating and continue on regenerating until maybe 25, 29, 30, 35. But later on, the degeneration takes over. It's greater degeneration than regeneration in your tissue. So because of that, we lose our fountain of youth, which is hormones. Now, the bioidentical hormones is, honest to God, what your ovaries make, whether it is estrogen, progesterone, and or testosterone, all that. These are most important hormones in our body too. So I gave a lecture not too long ago in London, and what I said is hormones are not for sex only. Hormones beyond sex. What I meant is that hormones have neurotransmitters function. So in other words, lack of testosterone in a man, he becomes depressed. Lack of a testosterone in a woman.
You noticed your husband's ladies, that testosterone is starting to dwindle?
Yeah, she loses her decision making, her focus, she becomes like flying here, there, and everywhere like a lost leaf in the wind, and she's not anchored, you see. So in spite of the fact there are like lack of estrogen in a man, he loses his memory for recent events. Estrogen in men. And not only this, but actually it devoid that man from empathy, sympathy, love, connectivity. As a result of that, they call them heartless. But men, as they age, they make more estrogen than in their youth. And as a result of that, you hear that saying, they say, he had softened his heart in his old age. Have you heard of that?
Yes.
So what happened? He's the same man, but now he has greater amount of, his testosterone is transformed at a greater amount from testosterone into estrogen. So it gives him the love, the sympathy. Where have you been all these years? Now, all of a sudden, you're going to show me, love? Hello? The other interesting, they found that men that have tendencies to be criminals and remorseless are the ones that have the lowest estrogen there is, which is fascinating.
That's
You
fascinating.
see, so hormones are not only for sex. Hormones are neurotransmitters to everything in your function. Like, for example, I have patients that I take care of, addiction patients.
Right, I wanted to ask you about your addiction treatment.
Yeah, so any drug use or abnormal illicit drugs will drop the testosterone to basement level. And as a result of that, they can't make decisions, they can't stand for themselves, they're always passive aggressive, leave me alone. You can't make any sense with them. So only to take a patient, put him in a 28-day rehab center really doesn't cut it, because it's a whole global deficit or a whole global problem than otherwise. So back again to bioidentical hormones. When I replace anybody, each one of you is different, and I'm different than any other man, just the same way. So we really have to deliver the map of how we're gonna reach to our goal. If we don't have that map, we really don't know how to replace it. And one of the issues here that the pharmaceuticals are up in arms is that they cannot brand the natural hormones. They can't put a name to it and sell it, and they call it R, the registered trademark. and they call it brand name rather than generic, you know what I'm saying? So this is one of the issues. So they like to, smear mud all over the bioidentical hormone. But we give bioidentical hormones in the dosage. We're not going to make a woman 65 years old. We're not going to make her 18 or 20 or 25 or even 30. We're going to make her maybe 35, 40. and level. So that's adequate to actually navigate life and enjoy life. Because without it, our enjoyment is kind of went down the toilet. We don't have enjoyment. We don't have a meaning for life.